So my journey into medicine began at a young age. My father was a dentist and my mother was a nurse. There were several other physicians with aunts and uncles, and so often in the early ages I had a very good exposure to the field. My father ran a free dental clinic and he did it on the weekends, and one thing we got to do as kids, which we were always excited about, was to go and help him. He didn't have assistants, and so we got to hold the light, we got to help clean the patients in the chairs, and it was just very early on, there was a very natural appeal to the healing arts, and so that's what got me interested in medicine. The reason I chose neurosurgery out of anything in medicine is it's one of the greatest fields. There's a big mystery of the brain. It's one of the things we understand the least, and so there's always something we can learn, we can be better at. Additionally, some of my family members have had neurosurgery. My mother's had brain surgery twice, and so it's a unique perspective to be on the other side of things and sort of see how that works. And so seeing how the physicians treated our family and got her through those operations had a big impact on me. Outside of neurosurgery, I enjoy spending time with my 3-year-old daughter and my 1-year-old son and my wife of 6 years. She's also a physician, so the family time we get together we cherish. We met in medical school here. We've been gone for the last 8 years, and oh my goodness, has Nashville grown. It's quite a special city to us, obviously, because we met here. We're raising our children here, and we couldn't be more thrilled than to be back in the South and to be back in Nashville. My patient care philosophy, it comes from 2 theories. One is, what if this were my family member? How would I want them to be treated? That's one thing I like to think about. The second part is using minimally invasive techniques. If there's a way to do the operation, causing less trauma or tissue damage, and using minimally invasive techniques, I think that's very helpful. One of the great mentors I had in medical school and while I was in Nashville was Dr. Robert Miracle, who was one of the founders of this group. I met him as a first-year medical student, and from then on, the rest is history. He helped me every step of the way, from medical school to getting into a residency. I trained at the same institution he went to, and then ultimately it's really an honor to get to join his practice. Doing an operation to help somebody relieve their pain, the fact that when they wake up from surgery, their leg pain or their back pain is better, and they can go back to doing the things they love, like gardening or walking around. Those little day-to-day things we take for granted, giving somebody back their life is very, very gratifying. And in that regards, that's the best part of being a neurosurgeon. It's such a privilege, a pleasure, and an honor to work for these people. That's something that I don't take lightly, and I don't think our group takes lightly, and that's the best part of my job.